Superior and inferior peroneal reticulum. The superior peroneal reticulum connected the lateral malleolus of to the lateral surface of the calcaneum. B. The inferior peroneal reticulum binded the tendon of the peroneum longus and brevis muscle to the lateral side of the calcaneum. Foot. The region of the foot includes four parts: the plantar region, sole, the part connected to the ground; the dorsal region of the foot, dorsum of the foot, part directly superiorly; the heel region, heel, the sole underlining the calcaneus; the ball of the foot, the sole underlining the head, underlining the head of the medial two metatarsals. The plantar surface of the foot is also known as the sole of the foot. It's covered in a layer of thick cornified skin that is nerve-less sensitive. Under the skin is a layer that is calculated subcutaneous fat. Under the subcutaneous fat is a thick facial layer that covers all of the muscle in the foot, the plantar, aponneus or plantar fascia. There are four layers of intrinsic muscle that are present in the foot. Deep fascia. The plantar aponneus is a triangular thickening of the deep fascia that connected the underlying nerve, blood vessel, muscle. The apicus is attached to the medial and lateral tubercle of the calcaneum. The base is divided into four splits that pass into the toe. Muscle of the sole of the foot. The muscle of the sole are conventionally described into four layers from the inferior layer superiorly. First, abductor hillicus, flexor digitorum brevis, abductor digiti minimi. Second, quadriceps plantae, lubricate lumbricals, flexor digitorum longus tendon, flexor hillicus longus tendon. Third layer, flexor hillicus brevis, abductor hillicus flexor digiti minimi brevis. The fourth one, interosseous perineum longus tendon, tibialis posterior tendon. Unlike the small muscle of the hand, the sole muscle have a few delicate functions and are chiefly concerned with the supporting of the arch of the foot, although their name would suggest control of the individual toe. This function is rarely used in most people. The first one, abductor hillicus, originates medial tuberosity of the calcaneum and flexor reticulum, insertion base of the proximal plant of the big toe, nerve supply medial plantar nerve, action acacia, relaxed and abducted big toe, branching medial longitudinal arch. The second one, flexor digitorum brevis, originates medial tubercle of the calcaneum. Fourth tendon, action fourth tendon of the forelateral toe, inserted into the border of the medial phalanx tendon, perforated by those of the flexor digitorum longus. Nerve acacia, medial plantar nerve, action acacia flexus lateral fourth toe, abductor digiti minimi, medial and lateral tubercle of the calcaneum, insertion base of the proximal phalanx of the fifth toe, nervus acacia lateral plantar nerve, flexus and abducted fifth toe. Muscle of the foot, second layer, flexor accessory pedicularis, quadriceps plantae, originates medial and lateral side of the calcaneus bone, insertion acacia tendon of the flexor digitorum longus, innervation acacia lateral plantar nerve, function acacia 8 long flexor tendon to flex lateral for the toe. Flexor digitorum longus muscle. Flexor digitorum longus is a thin muscle that belongs to the deep posterior muscle of the leg. Flexor digitorum longus muscle, originates posterior surface of the tibia, insertion base of the distal phalanx of the digit 5 to to 5 functions: metatarsopharyngeal and interpharyngeal joint. Innervation के tibial nerve के blood supply के posterior tibial area. Lumbrical origin के tendon of the flexor digitorum longus, insertion के dorsal extensor expansion of lateral foretoid. Innervation के first lumbrical nerve from the medial plantar. Action के extended toe at the interpharyngeal joint. Flexor longus, shaft of the tibia, base of insertion के base of the distal phalanges of the toe, nerve supply के tibial nerve. Action के flexor distal phalanges of the big toe. Plantar flexus foot supported medial longitudinal arch.